Yemen is a water-scarce country. The protracted conflict and the underinvestment in water infrastructure today deprive millions of Yemenis of access to clean and drinkable water. Several underlying causes are contributing to exacerbating the water crisis in Yemen, including the proliferation of khat as a cash crop, which consumes more than 40% of Yemen's total renewable water resources and 32% of all groundwater withdrawals. The rate of groundwater overdraft is currently much higher than the recharge rate and is increasing, bringing depletion of water reserves, inequity, and shortages. It is estimated that 17.8 million people lack access to safe water and adequate sanitation services in Yemen. The current water network reaches less than 30% of the Yemeni population. Thus, millions of Yemenis, including women and children, need to walk for miles to fetch water. Lack of access to clean water has caused major health outbreaks, including cholera and acute watery diarrhea that started in October 2016, leading to the country's worst cholera outbreak in modern history. That 2.5 million cases were reported, and more than 4,000 people have died in the Yemen cholera outbreak. Thanks to efforts done by the international organizations, the harshness of the situation is alleviated at some point for the citizens. The ICRC has been addressing the most urgent needs through the repair of boreholes and water stations, distributing water to detention facilities to reduce water-related disease outbreaks, and rehabilitating sewage systems. It also supports the maintenance of water networks and the provision of chlorine tablets, fuel generators, and maintenance tools to local water and sanitation corporations to ensure the continuous provision of safe water. However, the suffocating water crisis has led to many consequences, including the cessation of the government water network project from pumping. And it's worth noting that the salary of government and private employees doesn't cover the cost of obtaining drinking water, especially in light of the lack of it, and members of the same family are working in more than one profession to confront the crisis that is added to the economic, health, and other crises.